Hi, welcome to Dr. Wood's office. Today I want to cover a question I get asked a lot, or maybe you have this question, is what is a functional movement screen? A functional movement screen is a special test that's developed by an orthopedic sports physical therapist by the name of Gray Cook. When I started looking at this test, after 17 years of practices, finally someone has done something that I always wanted to do, which is answer why a person is having pain or why they got injured to begin with. As doctors, all of us are trained that when you have a problem, we typically lay you down on a table and we'll start to look at your knee, your back, and we'll find out what is wrong. So, oh, your knees hurt. Oh, you have a meniscus tear. That's what is wrong, but it doesn't answer why that became injured to begin with. So a lot of times we'll make your knee feel better, you'll go back into life, you'll start doing some stuff, and next thing you know, your knee's hurting again. Alright. So how does a functional movement screen work? It's 7 tests that simply looks at, does one side of my body work like the other? For example, we may have you put your arms out like this, kind of tuck your thumbs, and look and see how closely you get your arms together. If I do this and all of a sudden one side looks like this, that would be a pretty significant problem. That means when you go to run, one arm, you can't get it to move the way you want to, and that's going to throw you a little off balance when you go to run. If you're going to be doing pressing, lifting weights and pressing weights above your head, and you've got a straight bar or a fixed axis machine where you're pressing like this, you're going to make this problem worse. So instead of doing strengthening exercise first, a functional movement screen is a really good idea to do before you start exercise. You don't know, what should you exercise? Should I be stretching? Should I be strengthening? What should I be stretching? What should I be strengthening? So for people to go into the gym and just start working out, you don't even know what you're doing or where you're doing it or whether or not your program's effective. Why not improve the way you move and you're going to get a better result? Now, as far as why someone has back pain, let's suppose we find you had a back problem, and most people when they get injured, they don't get injured laying on the table or laying on your back. The functional movement screen says, hey, let's put you in motion and find out what it looks like. So if you're trying to squat and you're rounding your back, when you're squatting, you're hanging on your back in your disc and ligaments, and that's probably why you're hurting your back. You don't know how to squat. Now, the question is it that you don't know how to squat and your technique's wrong, or there's something wrong with your brain and body connecting? Or is it my hip is so stiff that I can't move and I have to round my back to get down there? So a functional movement screen can answer that question of like, why your back pain keeps coming back. You don't know how to lift. You're not lifting properly. We would want to correct that so that way if we fix what's wrong, I herniated my disc, we also need to find out why you herniated. You don't know how to lift. So we want to teach you both, and the functional movement screen will allow me to do that. Now, in evaluating young athletes, a lot of parents assume that my child is fine, they're ready to go and play sport. And that's not really what's happening. The statistics are showing that small children, 9, 10-year-old kids, are coming up with adult injuries. They're tearing ACLs, they're tearing their knee, they're injuring their back. And that's just totally unacceptable. There's a reason for that. I could talk about that later if you ever want to come in and visit me of why that's occurring, or I'll cover it in another video. But let's suppose one of the things I might check with a patient on the functional movement screen might be a lunge. And if a child's lunging, why do I want to check a lunge? Because it's running or it's walking. And if they're going to lunge and their knee looks like this, then that could answer why they were just running across the field and why they tore their knee. Because if I run like this knee does not like it. It likes to be here. It likes to be lined up over my foot. And my torso likes to be up here. And it makes sense. As an athlete, I can spin and move here. Versus if I'm here like this, I'm in all kinds of compromised positions. And it doesn't take much of my knees in this position for someone to hit it and rip this apart. I played college ball, and I got hit a lot of times playing football. When the knee's in a good position, it's strong and stable, it's safe here. But if you're already pre-stressed to here, to the limit of my knee's range of motion, and someone taps me here, that's a game changer. It's gone. You've torn the knee right at that point. So the functional movement screen can reduce the chance of injury in your child. It can also answer why you have chronic knee pain when you run. Because if you're running, you're always landing like this, you're going to have a knee problem. Maybe not today, at some point in the future, because this is abnormal stress. These joints aren't lined up. They like to be right here. So that's another reason why I like the functional movement screen. If you have any questions or you want to learn more about the functional movement screen, you can go to functionalmovement.com or contact my office at 300 West Trenton Avenue in Morrisville. Thank you.